O positive. O positive is the most common blood type in the world, but this abundance does not make it immune to biological risks. One of the most significant vulnerabilities is tied to the structure of the red blood cells themselves. Type O expresses the H antigen, a surface molecule that certain pathogens exploit. For example, the cholera bacterium and norovirus attach more easily to the H antigen, making O-positive individuals more likely to experience severe dehydration or gastrointestinal complications when infected. Studies have shown that people with type O are disproportionately represented in severe cholera cases, and they may also be more symptomatic when exposed to common gut viruses. In addition, type O blood typically contains lower levels of two key clotting proteins, von Willebrand factor and factor VIII. This means that O-positive individuals tend to have longer bleeding times, which can complicate recovery from injuries or surgeries. Although this reduced clotting risk protects against stroke and deep vein thrombosis, it also raises the risk of hemorrhage in trauma situations. A-positive. A-positive blood, the second most common type worldwide, carries its own hidden physiological liabilities. The presence of the A antigen on red blood cells, while beneficial in some immune contexts, also increases the risk of hypercoagulability, an excessive tendency for the blood to clot. This characteristic has been repeatedly associated with higher incidences of deep vein thrombosis, pulmonary embolism, and coronary artery disease compared to type O. Elevated levels of certain clotting factors such as factor VIII and fibrinogen contribute to this risk, making A-positive individuals more prone to heart attacks and strokes. Moreover, the same antigen that strengthens immune defenses against certain bacteria may also provoke exaggerated inflammatory responses, a mechanism implicated in autoimmune diseases like type 1 diabetes and rheumatoid arthritis. Beyond cardiovascular risk, epidemiological studies have linked type A blood to a higher likelihood of certain cancers, particularly gastric and pancreatic. Researchers believe this connection may stem from how the A antigen influences cell adhesion and immune signaling, processes that can affect how cancerous cells grow and spread. Infections by Helicobacter pylori, the bacterium associated with stomach ulcers, also appear to cause more severe outcomes in individuals with type A, due to the way the pathogen interacts with the A antigen on the stomach lining. B positive. B-positive blood, found in roughly 10% of the global population, carries several under-recognized physiological risks. People with this blood type tend to have moderately elevated levels of certain inflammatory markers like C-reactive protein and factor IX, which can increase the likelihood of circulation issues in the extremities such as peripheral artery disease. While the overall clotting risk is lower than in type A, sustained vascular inflammation may still affect long-term cardiovascular health. In addition, the B antigen makes it easier for intestinal pathogens like Salmonella and certain strains of E. coli to attach to the gut lining. This increases the risk of more persistent or symptomatic digestive infections, as these bacteria exploit the antigen structure to anchor more effectively within the intestines. A. B positive. A. B positive blood, found in less than 4% of the global population, is the rarest among the major blood types. This rarity comes with a unique antigen profile that carries specific health risks. People with A-B blood express both A and B antigens, which has been linked to subtle changes in endothelial function, that is, how blood vessels regulate inflammation and clotting. As a result, A-B positive individuals may face a higher risk of microvascular complications, including circulation problems in the brain and extremities, especially with age or a sedentary lifestyle. Studies show that people with A-B blood are overrepresented in populations experiencing memory loss, suggesting that chronic low-grade inflammation may play a role in age-related neurological changes. Although A-B positive individuals benefit from being universal recipients in transfusion settings, this advantage does not protect them from internal vulnerabilities. In fact, some research suggests they may respond less effectively to certain respiratory infections, possibly due to immune regulation differences linked to their dual antigen profile. O-negative. O-negative blood, present in less than 7% of the global population, is vital for emergency transfusions due to its universal donor status. However, this same absence of surface antigens, no A, B, or RHD, comes with immunological drawbacks. The H antigen, which remains exposed on O-type red blood cells, serves as a binding site for aggressive pathogens like the cholera bacterium and norovirus. This makes O-negative individuals especially vulnerable to severe dehydration, vomiting, and gastrointestinal complications when infected. Another critical issue arises in pregnancy. Because O-negative individuals lack the Rhd factor, Rh incompatibility becomes a serious concern. If an O-negative mother carries an Rh-positive fetus, her immune system may treat the baby's red cells as foreign, producing antibodies that can cross the placenta and damage fetal blood cells, a condition known as hemolytic disease of the newborn. This risk is now manageable through prenatal care, but before modern medicine, it significantly impacted maternal outcomes. Additionally, O-negative individuals can only receive blood from other O-negative donors, making transfusion logistics more challenging in time-sensitive emergencies. A-negative. A-negative blood is an uncommon type, found in less than 2% of the global population. Its scarcity poses a critical risk in transfusion scenarios, as A-negative individuals can only receive blood from A-negative or O-negative donors, both uncommon types. In trauma cases or surgeries where compatible blood is urgently needed, this limited compatibility can delay treatment or lower survival chances if supplies are scarce. Biologically, A-negative individuals share the clotting risks observed in A-positive blood. Elevated levels of clotting proteins like factor VIII increase the likelihood of thrombosis, heart disease, and stroke. The absence of the Rhd antigen also complicates pregnancy, as it does with O-negative blood. If an A-negative mother carries an Rh-positive baby, her immune system may attack the fetus's red blood cells, potentially leading to hemolytic disease of the newborn. While modern treatments can now manage this risk very effectively, before medical advances it was a major cause of pregnancy-related complications, and it remains a challenge in regions with limited access to prenatal care. B-negative. From a biological perspective, B-negative blood shows a distinct vulnerability to gastrointestinal infections caused by bacteria like Escherichia coli. These pathogens recognize the B antigen and bind easily to the intestinal lining, increasing the likelihood of more aggressive and persistent infections. In addition, clinical studies have documented higher levels of C-reactive protein and factor IX in individuals with B blood, two biomarkers associated with vascular inflammation and long-term metabolic decline. While these effects may not cause immediate symptoms, they contribute to a gradual buildup of cardiovascular risk over time. B-negative is an exceptionally rare blood type, found in just about 1% of the global population. This rarity severely limits transfusion compatibility. B-negative individuals can only receive blood from B-negative or O-negative donors, two of the least common types. In emergencies, this narrow compatibility window means that matched blood may not be readily available, increasing the risk of complications during trauma care, major surgery, or childbirth. A-B-negative. A-B-negative blood, found in less than 0.5% of the global population, is not only the rarest of all blood types but also the most limited in terms of immunological compatibility. This type carries both A and B antigens but lacks the Rhd factor, resulting in a highly uncommon and difficult to balance immune profile. Recent studies suggest that this combination may lead to more erratic immune signaling, making it harder for the body to activate quick and coordinated responses to viruses and bacteria. While this doesn't indicate immune deficiency, it may reflect a tendency towards slower or less organized immune reactions in certain infectious scenarios. This extreme rarity also has critical practical implications. A-B-negative individuals can only receive transfusions from A-B-negative, A-negative, B-negative, or O-negative donors, all equally rare. In cases of surgery, childbirth, or severe trauma, the limited availability of compatible blood can delay medical response and increase the risk of complications. Let us know in the comments what problems you have faced due to your blood type.